Hi everyone, let's focus on the today clinical questions. A 60-year-old male suddenly experienced an intense headache. Okay. Described as the worst headache of his life. Then, followed by vomiting and photophobia. On examinations, he has neck stiffness and dilated pupil on right side. On further investigations, CT scans reveals bleeding in subarachnoid space. The next question said that which of the following is the most common cause of these conditions? Can you guess a true option of this question? We got the correct option of this question, that is intracranial aneurysms. And as the questions say that there is dilated pupil and worse headache, there is intense worst headache, vomiting and photophobia. This shows that there is subarachnoid hemorrhage occur, and the most common cause of subarachnoid hemorrhage is intracranial aneurysms. Then what are the other clinical features that present in this case? And we mentioned that cause of the spontaneous subarachnoid hemorrhage is intracranial aneurysms. Okay, and next is hypertensions, AV malformations, anticoagulant, and brain tumor, the causes of the spontaneous subarachnoid hemorrhage. Among them, this is intracranial aneurysm's most important cause. And next is what are clinical features that present in case of subarachnoid hemorrhage. Then clinical feature mentioned also in the questions here is, we know that patient having severe headache and vomiting, which is sudden headache, okay, and due to raised intracranial pressure, if there is raised intracranial pressure, the patient having sign like photophobia and neck stiffness, and facial focal neurological defect like hemiplegia and dysphagia, and eye change. This ptosis means dropping of the eyelid, okay, and dilated pupil and abnormal eye movement. Why there is the abnormal eye movement? Because as you know that intercranial hemorrhage can also disturb the fifth or sixth cranial nerve that supply the eye, okay. Then sudden loss of consciousness, that is clinical features, okay. There is further investigations can be performed in case of patient with such type of symptom. Main is imaging technology, that is CT scan, okay. There is a primary imaging choice of the investigation in case of the intracranial hemorrhage, okay. And there is second angiography. In angiography, we select the carotid and vertebral angiogram to identify the aneurysms or vascular malformations. And the second investigation of choice is lumbar puncture. If the patient having the meningitis, in case they also such have symptoms, so to evaluate this test, to we can perform lumbar puncture, okay. Some surgical interventions we can manage like that: wrapping of aneurysms, okay, craniotomy followed by the necessary procedure. There is a make hole in the skull, that's craniotomy, and ligation of the common carotid artery, risk of hemiplegia. There is but in this case there is a hemiplegia, therapeutic embolizations to block abnormal blood vessels, incision of vascular malformation. That are the some management we can perform in patient with hemorrhage, intracranial hemorrhage. Most common cause is aneurysms. Which aneurysms? Intracranial aneurysms. Thank you.